The Vivos appliance has basically changed my life. It's changed my family's life and has changed a lot of my patients' life. All of my children have had the Vivos appliance. Gracie, my youngest, has had it since she was 6 years old. And she basically went from a bulldog, a class 3, to a normal bite, normal airway, normal little girl, no surgery involved. All of my children have had the appliance. I myself have used the appliance. It is why I'm still practicing today. I've been in practice for about 15 years, and I was starting to have some trouble with my back and my neck and my hands. I wasn't sleeping all night long. I didn't put 2 and 2 together. The minute I got the Vivos appliance and found out I could sleep through the night, didn't wake up at 2 or 3 in the morning with all this stuff going through my brain that I thought was stress, it actually all was airway. The minute my airway started to open up, the minute I stopped creaking my neck, moving my neck in a position to facilitate an airway that wasn't there, I no longer had neck pain. I no longer had numbness in my hands. That's honest to goodness. I mean, otherwise, I don't know if I would still be in dentistry. I'd be lecturing. The first Vivos appliance, I sat with a patient. He went home, started using the appliance. The mom came back 2 weeks later ecstatic. "You've cured him." I said, "What do you mean I've cured him?" His little brother, they sleep in the same room. I put the Vivos appliance in the patient. He stopped snoring. His younger brother started getting sleep at night, went off all of his ADD medicines, was no longer attention deficit, was a total different child. I had a 10-year-old come in that had only had the appliance for 2 weeks. She rolled over and broke the appliance. And she knew she had to get it fixed. She started crying because she had to be without her appliance. A 10-year-old realized how well she slept after 2 weeks. That's a child, they don't lie. Several patients have come in with headaches, especially young patients have come in with headaches, and adults as well, but we have taken those patients in a matter of a few weeks of the appliance, the headaches are gone. So we have worked, and it's funny because that's one way to get the patients to wear the appliance. To some of the kids, when they don't sleep with the appliance, they wake up with headaches. When they do sleep with the appliance, there are no headaches. We had a young man come in that had exercise-induced asthma. Now, he already had spacing in his teeth, so it's an interesting case because he wanted ortho to close the spaces, but he didn't have tongue room. So we put him in a Vivos appliance, we created tongue space, and in less than 3 months, he went to full participation in high school sports, where he couldn't before with the Vivos appliance. Now again, anybody else would have closed those spaces down, but by paying attention to the tongue space and how little was there, we were able to keep his smile and give him the quality of life to enjoy what he liked to do, which is basketball. How we breathe is so very important. Do we breathe through our nose? Do we breathe through our mouth? Is the airway adequate to get sufficient air in and out without resistance? By increasing the airway, by increasing the oxygen flow, we can prevent things like fibromyalgia, chronic fatigue, high blood pressure, diabetes. Everything that I'm talking about, all those metabolic disorders are related to airway. So the more we do to benefit the airway, the entire body doesn't compensate, and we have better health, better quality of life down the road. So when people think of smiles, they think of a beautiful smile. But behind that smile is tongue space and the airway. If we don't have room for the tongue, we have airway issues, and the body compensates accordingly. The longer it compensates, the worse things can get. Sleep disordered breathing, apnea, snoring, chronic fatigue, fibro. There's 300 metabolic disorders that follow airway. So when we look at patients, we're looking at available tongue space, we're looking at the airway in general, and we're looking at the way to improve that. And in doing so, with the Vivos appliance, we can not only accommodate that, we can also create a beautiful smile. The difference between the Vivos and orthodontics is, again, it's not an inflammatory process. We're not pushing things through. There's no pain. So by working with the body, when we move the teeth, we move foundation around the teeth. By moving the foundation, we'll make a straw into a snorkel. So our CT scans before and after verify we are literally changing the airways, oral airway and the nasal airway. We're turning mouth breathers into nose breathers. So by creating the nice smile, the perfect smile, the smile that is U-shaped, not V-shaped, not cut in where the molars start, we need to look at that molar space. And we don't in orthodontics. We look at what we see visually up front. It's everything behind that is so important. So if you have headaches, if you have TMJ, if you have airway issues, if you have snoring, if you're grinding your teeth, if you're wearing your teeth down, if you have crowding, I strongly recommend you come in, at least get an opinion, just get an idea of what the Vivos product is all about.